Heart, structure, location, and blood supply. The heart is a vital muscular organ responsible for pumping blood throughout the body, supplying oxygen and nutrients while removing waste products. Structure of the heart. The heart has a complex structure divided into chambers, layers, and associated valves. Chambers of the heart. 1. Right atrium. Receives deoxygenated blood from the body via the superior and inferior vena cava. Pumps blood into the right ventricle through the tricuspid valve. 2. Right ventricle. Pumps deoxygenated blood to the lungs via the pulmonary artery for oxygenation. 3. Left atrium. Receives oxygenated blood from the lungs through the pulmonary veins. Pumps blood into the left ventricle via the mitral or bicuspid valve. 4. Left ventricle. The most muscular chamber. Pumps oxygenated blood to the body through the aorta. Layers of the heart wall. 1. Endocardium. Inner lining of the heart, smooth surface to reduce friction during blood flow. 2. Myocardium. Thick muscular layer responsible for contractions. 3. Epicardium. Outer layer, forms part of the pericardium. Valves of the heart. 1. Atrioventricular valves. Tricuspid valve, between right atrium and ventricle. Mitral valve, between left atrium and ventricle. 2. Semilunar valves. Pulmonary valve, between right ventricle and pulmonary artery. Aortic valve, between left ventricle and aorta. 2. Location of the heart. Position. The heart is located in the thoracic cavity, slightly left of the midline in the mediastinum. Orientation. The base top lies near the second rib. The apex bottom points downward, slightly forward, and to the left, lying near the fifth intercostal space. Surroundings. Encased in the pericardium, which provides protection and reduces friction. Flanked by the lungs and rests above the diaphragm. 3. Blood supply to the heart. The heart requires its own blood supply to function effectively, provided by the coronary circulation. Coronary arteries. 1. Left coronary artery, LCA. Left anterior descending, LAD, artery, supplies the front of the heart. Circumflex artery, CX, supplies the left atrium and parts of the left ventricle. 2. Right coronary artery, RCA. Supplies the right atrium, right ventricle, and portions of the conduction system. Posterior descending artery, PDA, supplies the back of the heart. Coronary veins. 1. Great cardiac vein, drains the anterior heart surface. 2. Middle cardiac vein, drains the posterior heart surface. 3. Small cardiac vein, drains the right heart. 4. Coronary sinus, collects blood from the coronary veins and empties it into the right atrium. Collateral circulation. In case of blockages, small vessels, collaterals, develop to maintain blood supply. 4. Clinical relevance. 1. Heart attack. Myocardial infarction occurs when coronary arteries are blocked, cutting off oxygen supply to the heart tissue. 2. Angina, chest pain caused by reduced blood flow to the heart. 3. Coronary artery disease, narrowing of coronary arteries due to plaque buildup.